Today I'm presenting a brief history of the rice diet, Dr. Walter Kempner's weight loss protocol, one of the fastest ways to lose weight, and our group challenge on school, which starts this weekend for a chance to win a $50 Amazon gift card. The rice diet, so most famously known in recent history as a weight loss protocol, often producing losses of up to a pound a day and as much as water fasting, and definitely the first month. But it didn't begin as a weight loss plan. Originally, Dr. Kempner's higher calorie rice diet treated malignant hypertension and kidney disease, for which there were no drugs or dialysis at the time. Most people with severe hypertension died within months. He treated kidney disease and heart failure. Later, he saw remarkable results in diabetes, obesity, and even conditions such as lupus and psoriasis. He reversed blindness from diabetic or hypertensive retinopathies. Diabetes surprises a lot of people. So few doctors today are aware of this fact that complex carbohydrate diets like the rice diet are in fact remarkably beneficial in type 2 diabetes. Here is a patient case. He lost over 200 pounds. His A1C went from 11 or nearly 11 down to 5, which is normal, reversing his diabetes all with the rice diet while reducing his medications from 7 medications to just one half of a blood pressure med. And if you have time, check out the full video presentation by Dr. Frank Nealon on YouTube. By the late 1950s, the rice diet truly became nationally famous as a weight loss program. It attracted patients from across the country, including actors and celebrities. Patients began traveling to Durham, North Carolina to stay in rice houses. It's like a bed and breakfast. These residential homes were where patients lived while following the diet. Although many had serious medical conditions, increasing numbers came primarily to lose weight. And between the 1960s and 70s, it was nicknamed the diet capital of the world, with books, magazine articles, and television exposure helping make the rice diet an iconic destination for obesity treatment. And local restaurants began offering special menus for Dr. Walter Kempner's patients with limited items limited in salt, fat, and calories. And Kempner published major studies, including for treating massive obesity. This is the medical paper where these old black and white photos come from. It contains the prescribed regimen for weight loss, which is a calorie restricted, high carb, low fat diet consisting of rice, fruit, vegetables, lean protein, lean meat, low calorie, less than 1,000 calories per day, low sodium, and supplemented daily with multivitamins. And it just so happens to be a low calorie density plan. Here is a printable PDF in my school app, and the green section are those food groups I just mentioned, the fruits, vegetables, including potatoes, wet grains like steamed rice and oatmeal, and lean proteins such as legumes, lean meats, all prepared without fat. These are the lowest calorie foods in the world. Eating low calorie density is a scientifically proven way to lose weight by eating more. And what calorie density tells us about a food is a food that's low in calorie density is hard to overeat, making it more difficult to gain weight. And then a food high in calorie density is easy to overeat, making it easier to gain weight. For example, what is easier to overeat? 2 tablespoons of peanut butter or 4 cups of carrots? 1 cup of almonds for 800 calories, or 17 cups of strawberries. Oil versus potatoes. And potatoes are an excellent weight loss food, lower in calories even than rice, chicken breast, and it's less than half the calories of pasta, eggs, and avocados. But as soon as you cook a potato in fats, it no longer becomes a low calorie food. Oil is the highest calorie processed food in the world. Whole olives are around 600 calories per pound, and that's the food you would find naturally in nature, versus olive oil at a whopping 4,000 calories per pound. And it's not just the fat foods versus the low fat foods. Fresh grapes, for example, are one-fourth the calories of raisins. And so, focusing on the water and fiber intact fruits and vegetables. And so, what low calorie foods have in common is they're high in water and they're low in fat. And you'll get a bigger portion every time choosing these low calorie whole foods. And so, the more we eat in the screen section, the easier it will be to lose weight and the bigger portions we will get to have. And so, before I talk about the group challenge and the prizes, just remember to give yourself grace. It's important to enjoy the process of losing weight because if it becomes something that you hate, you're unlikely to stick with it long term. And think progress over perfection. The rice houses have closed. We're doing this from home. We are no longer able to stay in a hotel like bed and breakfast for months at a time, living only with people who eat exactly like you, where all of your meals are prepared for you. So this becomes increasingly difficult when you live with others who eat differently or you prepare meals for others. But it is possible to start making better food choices right now and start seeing results. And this doesn't need to be all or nothing. For example, can you fill half your plate with fruits and veggies? And maybe the other half is a donut, but at least you're doing something. An ideal plate might look like half fruits and veggies, the other half grains, starches, and lean protein, reducing fat and sodium whenever possible. Or your plate might look like this if you're doing step one. So we can do dietary perfection for a little while. Maybe you can be perfect for 4 days, 4 weeks, or even 4 years. But eventually, many of us fail to maintain those rigid expectations all the time. And so, what happens when you fall off the wagon or when you go from one diet to another? I was stuck in that all or nothing trap for a long time. The I'll start on Monday syndrome. Yeah. So there are behaviors that we practice that keep us fat. Whatever the reason you've fallen off or you haven't started, are you giving yourself permission to have a regain vacation? Right. So we want to stop all of those regain moments. If there's a moment where you're not eating particularly healthy, you can still do one thing. I challenge you to start doing this today, regardless of what you eat, good or bad, and that's following a calorie deficit. Everyone hears calorie deficit, calorie deficit. Basically, I tell myself, you can eat whatever you want as long as it fits within your calorie deficit, your daily calorie budget. And if you really are honest with yourself and look at what you're eating and you track your food, when you know you're tracking, or especially if you know you have to share it with other people, you tend to eat less than you normally would, just left to your own devices. And then choosing those healthier calories most of the time, that's going to bring you even more results. But eating off plan doesn't need to be an excuse to continue gaining weight. This brings me to our group goals and the August challenge. Maintain a calorie deficit and include as many steps one and two foods as you can. And so, for some people, for a little while, that could be 100%. That's great. These are your wet grains, fruits, and veggies, but it doesn't have to be 1% or 100%. And for example, you can just simply fill half of your plate with fruits and veggies and reduce the fat and sodium of your meals whenever possible. Your calorie deficit is simply the amount of food you need to lose 1 to 2 pounds per week. And even losing just 1 pound a month, you're technically in a calorie deficit. And so weight loss happens when we consistently consume fewer calories than we burn. And you might not want to go as low as Dr. Walter Kempner's treatment of massive obesity. That's up to you. My husband, for example, he ate around 1,700 calories most days in the month of June, and he dropped 17 pounds. And I do tend to lose weight eating lower calorie, and I do like to stick to uh, Dr. Kempner's 1,000 calories limited. Um, and so everyone will lose weight at a different pace, and that's okay. Of course, the closer we get to dietary excellence, the better our results are going to be. But you don't have to be perfect to start seeing results or to start sharing your meals in the group. And so during this month's challenge, what you eat is up to you. Do the best you can at maintaining your calorie deficit and sticking to the steps 1 and 2 foods, more fruits and veggies, less fat and sodium. And I have 2 prizes. So, one is a team building activity. This has nothing to do with weight loss, it just is to encourage group engagement. And so, the most improved on the leaderboard will win. So, you're assigned a number from rookie member to ranked champion. And this is based on your posts, likes, and comments in the group. And so, simply giving feedback and encouragement to others and posting your meals, this will give you a chance to win the $20 Amazon gift card at the end of the month. And then I'm also hosting a weight loss contest this month. For this prize opportunity, you must post your August 1st weigh in the group sometime this weekend. And I see there was already 2 or 3 people have already gotten started. So that's awesome. And a winner will be selected based on the greatest percentage of weight lost. And so if you read this little paragraph later when you have time, yeah, most people understand what that means. And it just basically means somebody who has less weight to lose is not at a disadvantage. Okay, alrighty. So I will end the presentation here. And if you would like to turn on your camera, just let me know if you have any questions.